everyone. I'm Dr. Lisa Palmer. Hi everyone. I'm Dr. Lisa Palmer, Dr. Mama Bear on dizziness, dudettes, and dynamic health. I had to look up the rest of my title. Dizziness, dudette, dynamic health. You guys are on message for me. Let me know where you're from. I got asked earlier today, what is the cause of dizziness? Why do people feel dizzy? Well, there could be feel dizzy. In the day when my health was a bit compromised due to a mercury toxicity, spin with no real reason why. Later, I found out I had mercury negatively affecting my, and I also had very impacted ears. And so some of you guys have had where they take a device and then they can pull out the stuff that comes. And so the technician that was performing that was like, that's not what you want to hear coming out of your ear. Obviously, it wasn't a real squirrel, but there was some impacted wax. I think it was from when I played professional ball, really irritating my ear. And so dizziness can occur from the ear having dizziness can occur from digestion. So your eustachian tube can get irritated through consumption of dairy, inflammatory foods, even trauma. And things can back up into the ear, and that can cause dizziness. They get above knees, stimulate an increase in blood pressure. So when you go to bend over to pick something up, the adrenal glands may not be so good. Is oftentimes the patient will tell me, well, yeah, I bent over to pick up the dog's toy, or I bent over and I got up too fast. Now you should be able to get up as fast as you want. And if you cannot, it may be that your adrenal glands are compromised. What could compromise the adrenal glands? Well, chronic stress, which would increase in the body. And so adrenal glands make you feel dizzy. There are parasites that like to eat red blood cells that could make you appear to have anemia. Some women, they have period death. You should not be. And if you are, it could be that you have imbalanced hormones. You do not balance your hormones by adding fake hormones. If you then you end up with dudettes. What do I mean by that in the title? I mean a dude that is taking a hormone that will imbalance other hormones. So if you are, as a female, if you take a hormone, so my case is working with a patient, and my female patient that I've known for like 10 years came in, and she was like super aggressive. She had rage. She's like, everybody on Inner4 is an idiot. And my boss, I don't like my boss. I don't like my coworker. And this is bad, and that's bad. And like, she's usually this like just sweet lady, and she came in rip mad. I had never seen her aggressive. And yeah, you can get mad. Like, that is a normal emotion to have. Like, something crazy happens, you absolutely can get mad. But it is not normal for a normally last decade pretty peaceful to be this mad. And so it was interesting because she brought blood work into me that appointment. And so I don't depend on my working with patients is not looking at every single pad or imaging. If they have them, bring them in, because I will absolutely read that. Absolutely take that data. But a lot of conditions are missed on blood work, so I don't strongly depend on it, but I will absolutely use it as a tool. And we can send people for regular blood works. If you're a patient, we can send for your annual blood work. We can parasite testing, mold testing. We can test thousands and thousands of dollars, but I don't want to spend this money, or I don't want to give patients a very big cost to find out that I could find out in a different way. And so anyways, our blood work that she brought in, and I did not know, she did not tell me she was taking testosterone. So women that get into their mid 40s, their late 40s, maybe they're going through menopause in their 50s, and menopause just means menses pause. It just means the period stops. So it doesn't mean dryness, it doesn't mean fatigue, it doesn't mean hair falling, it mean those things. It doesn't mean hot flashes. It period stops. You don't have that anymore. And so my patient, by her medical doctor, was prescribed testosterone. And she was told, going through the change. And so for anti-aging, so you don't have hot flashes, so you don't have dryness, things, I'm going to prescribe you testosterone. So she did. I don't advocate that, right? I believe in balancing the body naturally. So if you are on testosterone, if you're on estrogen, progesterone, whatever you're on, I am not advocating for you to stop cold turkey because you will feel like a crazy. Do not do that. I am not saying that. Do that. What I am saying is, with a synthetic hormone, it is your pancreas, it is your thymus gland, it is your ovaries if you're female, it's your testicles if you're male, it's your adrenal gland. I think I got all of them. And so when you put in a fake hormone outside, when you eat a hormone, it negatively affects the hormones, it negatively affects all your glands, and it always has an effect. So she brings me her blood work. Her doc was checking her testosterone levels because the doctor was prescribing testosterone. And her testosterone levels were really high, like really high. I don't remember, but they were really high. So I'm reading her blood work and I'm like, yeah, so did your medical doctor say anything about your testosterone being really high? And she's like, no, she said everything was good. And I'm like, well, your testosterone's very, very, very high, and I've never seen you be so aggressive in the whole entire taking with you. So she's like, yeah, I didn't want to know because I knew that you wouldn't be in agreement because you're my natural doctor, and I knew you wouldn't. I do like the good. So I'm like, okay, I can totally understand why and how you would do that. I go, however, it also has negative effects in other things. And I have never, in the last 10 years that you have worked with me naturally, I have never, ever, ever seen you so aggressive and so angry and so upset. So her blood work, and I showed her where her testosterone levels were, and she was like, oh my gosh. And I said, look, as your natural doctor, I can't tell you to not take it. I can't tell you to tell your doc it's too high, but I would encourage you strongly, phone call in right now if you want me to. I'm happy to make the call. That these are very, very high. And then you wouldn't take this hormone, advice. This is imbalancing your other hormones. And she's like, yeah, I understand that. So taking these kind of hormones can make women more aggressive, can make women grow chin hair, can make women grow chest hair, can make women have increased muscle mass, can increase. Some women like those, well, maybe not the hairy parts. And so instead, if you're dizzy, if your hormones are not balanced, if not quite right, there is absolutely a cause to that. In the holistic office in Central Florida, we check to see what is the cause. Maybe you have an imbalance in your thyroid. Maybe you have it in your adrenal glands. Maybe you have an imbalance in your pituitary. Maybe you have an imbalance in your ovaries. Maybe you have an imbalance in the different areas from a nutritional standpoint. We look to give them mineral, to give it the replacement will from a new body can rebalance. When the body is in balance, it doesn't have symptoms. Hot flashes are a symptom. Libido is a symptom. PMS is also called a symptom. Something is not right in the body. And what we look for using quantum nutrition testing is someone's living in mold, right? And so is it due to mold, right? Is it due, I don't know if you guys are not working well for some reason, although it just fine. So what is the reason? We look for the reason, we handle the reason, and then we get diagnosed. So I guarantee you can tell you from almost 20 years of experience that when the body is out of balance and we find the right why and we put to balance again, health improves this way and the person feels so much better. I'm Dr. Lisa Palmer, Dr. Mama Bear. Bye, everyone.